Hello everyone, welcome back to Pramay English. I'm Tuhina. On occasion of World IVF Day, we have with us Dr. Sujata Kar ma'am, obstetrician and gynecologist and MD at Kara Clinic and Hospital Bhubaneswar. So let's interact with her. Ma'am, what exactly is IVF and how does the process work?
So IVF is in vitro fertilization. It is a kind of assisted reproductive technology. How it works is that the internal function, which in some women and in some men is compromised, that entire process is done outside the body in a laboratory. So in vitro fertilization meaning that fertilization is done in the laboratory and subsequently the embryo or the baby is developed for almost 3 to 5 days and then it is left in the woman's body or the uterus to develop into a pregnancy.
How does the IVF differ from other fertility treatments like IUI or ICSI?
IUI is intrauterine insemination. It is very different from in vitro fertilization, which is IVF. In IUI, only the semen sample is prepared and left in the woman's vagina, which is very much like not very different from a natural intercourse. So IVF is very different. ICSI is a kind of IVF technology which is intracytoplasmic sperm injection. Only it is required for male factor infertility where a single sperm is used with a very advanced technology to fertilize a single ovum. Normally you may be aware that for one ovum you need lakhs and millions of sperms to fertilize in nature. But with ICSI only one egg and only one sperm is used. So that is how it is different from IVF.
What is the success rate of IVF for different age group?
So it can be very different. The younger the age of the couple, both men and women, the higher the chance of getting pregnant. So let's say less than 30, less than 35, less than 40, we calculate accordingly. So highest rate would be for somebody who is very young, within their 30s, and very poor rates of pregnancy with IVF beyond let's say 35, 37 or 40 years age.
Okay. Is there any higher risk of birth defects or genetic disorders with IVF babies?
So see, IVF has been in use now for almost 40 years plus. And the short answer to your question is largely IVF is a safe technique and the rate of birth defect is not very different from that in the general population. But some defects have been found to be more, like cardiac abnormalities, some neurological issues, male fertility problems. For example, if a man is infertile and he has a male child through IVF, the chances of that male child inheriting that infertility from the father is high. So very small chances that the birth defect might be higher. But we have to remember that infertile patients are infertile because of a reason. And also they are older in age. With older age, birth defects are more. With inherent genetic abnormalities, birth defects are more. So it is possible that IVF might increase the chances of birth defects because of these two factors also. And a very small percentage may be contributed from the environmental factors because it is a externally conceived pregnancy.
How should a woman prepare her body before starting IVF?
IVF is a big process and it has to be started properly. The body, the mind and all the investigations for both couples should be normal before they try to get into IVF. So typically we have two stages before actual IVF process. One of them is pre-IVF investigations. Second is pre-IVF optimization. Investigations is what the doctor suggests to you. Optimization is what the doctor suggests in the form of some medications to improve your chances, and also what the couple does to increase their chances. That I would include as stress relief, exercise, yoga, proper diet, trying to get into a proper exercise mode, trying to have a good weight, body weight, and so many things that are included in a pre-IVF optimization.
Okay. Ma'am, can IVF a costly procedure? Means, what are its pricing range?
So yes, IVF is a expensive procedure. The typical price will vary in between different cities, primarily because of the pricing tiers that are existing in, let's say, metros and tier 2 cities and then a smaller city. But let's say in a tier 2 city like Bhubaneswar, an IVF cycle would cost somewhere from 1.5 to around 2 lakhs, and in metros it might go much higher. This is just a very basic rate that I have told you. It costs approximately that much.
Okay. On occasion of World IVF Day, any message?
So IVF is not only a medical procedure, it is a lifeline for many couples who are unable to get pregnant. So as the years will go by, I am sure that science will break barriers and the chances, the success rate of IVF will go on increasing. But for the patients and couples, they need to have courage, they need to have patience, and that is what will translate into success.
Thank you so much, ma'am, for
Thank you.
sharing all this.
Thank you so much. Thank you.